All right, good afternoon, everyone. I thank you all for joining us. I see a number of participants are still getting logged in, but we are going to try and cover today's materials in about an hour, allow some time for questions at the end. So I'm going to get started. We do want to make sure everyone is aware that we are recording today's webinar. This will be available for you to watch on our website. We have a resource section of our website with a page where we host our videos for different webinar trainings. So if you're looking for to review this after the fact or share it with anyone, it will be available there, and we'll drop a link to that into the chat at the end of today's training. My name is Sarah, and I'm the Director of Outreach at NYSARC Trust Services, and we're really happy that you came to join us today. We're going to be talking about a pretty specific topic of helping people qualify financially for Medicaid-funded home care services. Home care in your own home or apartment, or some other community-based setting, like living with a family member, utilizing an assisted living program, for example, and how to help people qualify financially for those services using a pooled trust. We do encourage you to submit any questions you have into the chat throughout today's discussion, and we'll try and go through as many of those questions as we can at the end when we have some time for Q&A. So this training and presentation is really geared towards individuals themselves, caregivers, family members, and professionals who work with people who may be in need of home care services, some level of assistance with activities of daily living, or perhaps it's an individual who just has very high medical costs due to a disabling condition or disabling chronic condition, chronic illnesses. And so these are all situations where someone may benefit from utilizing Medicaid to help them get access to a home health aide who can come into their home and provide assistance, and also help offset some of those high medical costs that they are having as a result of their care needs. So Community Medicaid benefits is a very robust program in New York State. It covers basic health benefits and also those long-term care services, which a person's Medicare benefits really doesn't provide. Medicare will cover up to a certain amount of time when someone is in need of long-term care. But when we're looking at a situation where someone needs extended support in the community, assistance with things like cooking, cleaning, helping them get out of bed, get dressed, those are things that require a little bit of extra care. And those are services that are not covered under a person's traditional Medicare benefits. Medicaid does provide long-term care coverage, and it also provides a number of other benefits like transportation to doctor's appointments, dental coverage. Many people who are retired don't have access to dental benefits any longer because they're no longer working for a company that might be paying for that. And it provides that home care assistance or some other form of long-term care services in a community-based setting. And when I say community-based, I just mean not a nursing home. In the community, either in your own home, a loved one's home, or some sort of community-based setting as opposed to a nursing home or institution. Now, individuals can qualify for these programs if they meet the requirements to need for long-term care. And they also need to meet specific financial requirements in order to be eligible to receive Medicaid benefits and have Medicaid cover the cost of those services. An individual can only have a certain amount of money in their name. And when Medicaid looks at a person's finances, they look at two key areas. The first is their assets. What are the money that they have in their name that can be easily turned into cash? Things like savings accounts, maybe they have some retirement accounts, stocks and bonds. Those are all going to be examples of assets that someone might have in their name. Some assets are countable for Medicaid purposes and others might be exempt, like the principal balance of a retirement account or a person's home, the primary residence that they live in. So the first step is to take a look at someone's resources and assets and determine if they're below this limit. Someone you're working with might have a pretty sizable income, but not a lot of money in savings or liquid assets, and they might meet those asset limits. Others might have funds that go above those amounts and they may need to spend down those funds somehow or private pay for services until they reach that level before they would begin applying for Medicaid. Once someone has taken care of their assets, or maybe they don't even have too many assets to qualify for Medicaid, they then look at a person's monthly income. How much income does a person receive on a monthly basis? And this is based on your marital status, as in if you are single, there is a income limit for how much you can have as a single individual. And then it goes up from there. If you're married, there are also additional budgeting options for individuals who are married. And there's one spouse that's in need of services and another spouse that may not be in need of services. And that's another option which can allow someone to keep a little bit, or the couple to keep a little bit more income and also assets, as you can see here on the screen. Now, in order to qualify for Medicaid benefits, if your income or resources are above these limits, you do need to spend down to those levels. When we're talking about the assets, the resources, there's lots of different options that a person has to spend down those funds. That is not necessarily something that someone would put into a pooled trust for many reasons. Typically in these situations, if you have assets to be spent down, you're going to be looking at other ways to do that. And you may be even working with a legal professional to help you transfer assets appropriately so that you can get below the limits to qualify for Medicaid. Now, I'm going to touch on this just briefly so that everyone is aware, and because this is a very timely topic right now. At this time, when you apply for community-based Medicaid benefits for long-term care services, there's no look-back period of a transfer of assets. So if I have assets above that $15,500 limit we just showed you, then I can transfer those assets in a way that is appropriate, and I can apply for Medicaid next month. So it's November today. I would transfer my assets in November and apply as of December 1st. And there's no look back period currently. Medicaid does not look at that transfer of assets, so I will not be penalized for doing that in order to become financially eligible for Medicaid. And that's been a really generous benefit that New York State has allowed for many years. They are one of the only states that does not have a community Medicaid look back period. Some of you might be familiar with the 5-year look back period for nursing home level care. That is for transfers of assets that you make. You want to do that within or outside of 5 years before needing that nursing home care to avoid any sort of penalty where you'd be required to private pay for services for a period of time. So at this time, I would be able to do that and qualify next month with no look back. But going forward, there is going to be a 2.5-year look back for community-based long-term care services. For any of you who have attended some of our previous webinars, you may know this very well already. We've been talking about this over the course of the last year since they really made this announcement in the spring of 2020. But this continues to be delayed. Initially, it was supposed to be implemented back in 2020, around October 1st, but due to the ongoing pandemic, there has been a number of delays. Right now, our current date that we're aware of, what we've been told is the potential earliest date that this would go into effect would be for applications after April 1st of 2022, but could be even later, maybe further delayed. So that's something that new information is coming out all the time. We want to take a moment to update everybody on that. So what that means is that if you're in need of home care services and you need to make transfers of assets in order to become financially eligible, those transfers would now be after October 1st of 2020. And that's what will be subject to this potential look back period when they do put it into place. But right now, because it's not implemented yet, transfers after October 1st would not be subject to the look back period as long as you apply for these services prior to them implementing that rule. So there is this window of time right now where people who are in need of home care services have the ability to make those transfers and continue to use the more relaxed rules that we have now to become financially eligible. I do want to point out that this is specifically for applicants of home care services and community-based long-term care services. So there are some categories of individuals that fall into that population who are using things called waiver programs, like the NHTD waiver or the TBI waiver or OPWDD waiver. It's important to point out that the Department of Health has indicated that they do not plan to implement this look back for that particular population, for those waiver program participants. So that's a really important note. I know we have a number of people on the call who do work with individuals who utilize those programs. So keep in mind that that is one kind of group of individuals that would not be impacted by this rule change. And it is important to point out that there are exemptions. There are different types of ways you can transfer assets that would not be subject to a penalty, and those same exemptions still apply. One example being funding a trust for a child with a disability. That's something, you know, we've covered in other trainings, but you could use spend down assets by using that money to create a trust for a child you have with a disability, other things like transferring to spouses. And there are other exempt assets. We would encourage you to speak with a legal professional if you have questions about the best options for you in your situation. So when it comes to the income piece, once someone has reached that level of spending down their resources, where they're now looking at the monthly income, they're going to calculate all of the sources of income that a person has. And income can come from many different places, depending on the individual you're working with. Someone might be someone over the age of 65, they're likely getting income from Social Security retirement. They're getting maybe a pension. Perhaps they're having to take distributions from a retirement account. Some people have alimony payments. There's lots of different types of funds that someone might be receiving. And Medicaid will take all of that into consideration and come up with what your total monthly income is. So for people whose income is above those limits, and like I said earlier, those limits change depending on your marital status. So for a single individual, if I want to qualify for Medicaid, I can not have more than $904 a month in monthly income. Any amount that is above that limit, as indicated in the red on the slide here, is considered my excess income or surplus income. This is a situation where I have too much money to qualify. And for qualifying adults, which would be people with disabilities and adults who are over the age of 65, people who have chronic health conditions that are requiring the need for the home care services, do have the option to spend down that amount that's above the limits in order to become financially eligible to receive services. And that is what's called a spend down, or a Medicaid spend down is often referred to. The Medicaid office will determine what that amount is. They'll tell you exactly down to the penny what someone needs to spend down on a monthly basis in order to become eligible and maintain on an ongoing basis their eligibility for those home care services. Now, we get a lot of questions about, is there, you know, a spend down amount that is too low, or is there a maximum that someone might have? It's really going to be very unique to the individual, what they have as far as the need for care, how much income they have, and how much they have in monthly expenses. There is no maximum, but there is a point where if someone's income spend down is so high that they may actually be able to cover the cost of private paying for services, and they may not need a pooled trust. But in some cases, someone's income might be very high, but they don't have a lot of assets outside of the trust. They are paying out the majority of their income in expenses every month for their rent, utility bills. Maybe they need to private pay for some home care services because they weren't getting enough hours from Medicaid. And those situations are something that, you know, you really evaluate on a case-by-case basis to determine if it would make sense for them to use Medicaid in those situations. As far as how low a spend down can be, you know, it really just comes down to whether or not it's enough money that warrants setting up a trust to protect that money. So here are the options when you have an income spend down of how to become financially eligible for services. So if I have income that's above the $904 a month, I can pay that money to Medicaid each month by cutting a check to my local Department of Social Services or the Medicaid office, regional office in my county. I can also use that towards the cost of medical bills. If I have medical expenses that are in my name that I'm paying on a monthly basis, I can pay those medical bills and submit receipts to Medicaid up to the amount of my spend down, and that would make me financially eligible for services. Once I had sent in enough receipts to meet my spend down, they would activate my Medicaid, and Medicaid could cover my services for that month. Now, in both of those options, it allows someone to meet the spend down requirement and become eligible for care. But it doesn't allow them to use that income for the things that they really need it for, which is their monthly living expenses, things that are going to allow them to stay in their own home and continue to afford to pay those bills. So there's a third option in New York State where the individual can deposit that excess income into what is called a pooled trust. Now, a pooled trust is allowable under federal and New York State statute for people with disabilities to protect money in order to become financially eligible or maintain their financial eligibility for Medicaid and other means-tested benefits. A pooled trust is a special type of irrevocable supplemental needs trust, and it's irrevocable to protect a person's eligibility for benefits. That means once you set it up, the funds that go into the trust become the property of that trust. A not-for-profit organization manages that money on behalf of the individual who's in need of services, who is called the trust beneficiary. That allows that money to no longer be counted against that person when determining their financial eligibility for means-tested benefits. The not-for-profit organization then helps the individual use that money to pay for things that they need, things that are for their primary benefit, and things that will allow them to live independently in the community for as long as possible. Pooled trusts are unique in that the funds are all pooled into one bank account for administrative purposes. But as far as the individual is concerned, their activity will be tracked in a separate sub-trust account. So it works like they'll have their own account that they put their money into, and their activity is really tracked separately. So it works just like in many ways similar to like a checking account that I have. Whatever I put into it, minus any costs associated with using that account, is available to me to use and submit requests to pay for my expenses. And the goal is to allow people who are in need of home care services and Medicaid health benefits to live at home and stay in their own community for as long as possible by being able to afford to pay their bills and get access to the care that allows them to live in their home and safely and comfortably among their family and loved ones. Now, one important thing to point out with any pooled trust and any supplemental needs trust that is funded with an individual with a disability's own money is that there is a payback provision to Medicaid that upon the death of the beneficiary, if there are funds left in the account, that those funds are either retained by the not-for-profit organization that administers the pooled trust to be used to help other people with disabilities that are served by their nonprofit, or it needs to go to the states that provided Medicaid services on behalf of the individual. Now, it's important that to point out that you receive the benefit of getting access to the home care services, being able to protect your income on a monthly basis, and use that to pay your living expenses during your lifetime. Most people are going to deposit their income and use it in the same month to pay their living expenses. So there shouldn't be a large balance in the trust upon the death of the beneficiary. But that's one of the reasons why it's very important to stay in communication with the trust and regularly submit requests to spend down the funds so you don't leave a large balance when the account is closed. So why might someone use a pooled trust? The primary purpose of using a pooled trust is to help someone qualify or maintain their financial eligibility for means-tested benefits, like Medicaid. So this is a service that is available and an option to help someone qualify financially for Medicaid. There are other options to become financially eligible, but this can be one of the best ways when someone doesn't have high medical expenses or they have a large spend down that they really need that money for their living expenses. Getting access to the Medicaid services allows the individual to get expenses covered that their Medicare benefits might not provide. Like I said, the long-term care services, and perhaps even other expenses that would be picked up by having that dual eligibility for Medicare and Medicaid. The individual, by taking advantage of getting Medicaid home care services in place, can receive those services from the comfort of their own home. They can get assistance with activities of daily living, things that are going to help them remain independent for as long as possible, and provide that support that's really needed to either completely replace or help offset support that might be provided by family members or friends. This gives someone the way to stay in their own home as long as possible. And in many cases, it offers an alternative to a nursing home placement. It can also be a program that allows someone to go back into the community, someone who might have been in a nursing home, who really could be served in the community and would like to return home. Finally, beyond just the benefits to the individual directly of getting them these services and being able to qualify financially for these services, it can also help family caregivers who might be providing unpaid care, who might be juggling their own, getting their kids to activities, to school, working full-time or maybe part-time to help care for their loved one. So this can help not only provide services that will help relieve them and make them feel comfortable, give them the peace of mind that their loved one's being cared for when they can't be with them. And it can also help offset some of the costs. Some family members are actually providing financial assistance to help someone get home care services. So this can be a way to help relieve them of those financial costs as well. Using a pooled trust, there are some costs involved with opening the account, and on an ongoing basis, there are monthly fees for the trust to administer the account and help the individual use the funds to pay their bills. So it is important, for people to understand that there are some, costs involved in using this program. However, these costs are deducted from a person's spend down deposit typically. And so if someone's already paying a spend down, it wouldn't be any more than what they're paying now. We can deduct those fees from that spend down amount. And in situations where someone's using the trust for the first time, it can be, this is something that they would pay. This would come out of their spend down. They don't need to pay it on top of their spend down. Although there are situations where someone may do that, and we'll talk about that as we get into some more information about how the money can be used. Beyond the initial one-time enrollment fee, there are monthly fees to use the account. These cover all trust activity, and these are just the fees for our program. Just as a point of reference for you, there are many pooled trusts in New York State, and each one might have a little bit of a different fee structure. So that's something you're going to want to look for a trust that has their fee schedule publicly available so that you can review it and compare these costs. Beyond that, in our program, there is also a $50 tax and audit fee that's charged once a year in July to cover the tax preparation for the trust and have an independent CPA firm come in and audit our operations. Again, these are different costs that might vary for each program, so you'd want to look into those expenses before moving forward with an account. We have no limit on how many requests you can send in each month, but some pooled trusts might have a set fee, and then they charge extra for additional requests above a certain amount. There are also some that will charge things like annual renewal fees, an annual cost to renew the account. So those are some things you want to look for when you're evaluating whether, the total cost of the program for the individuals that you serve. Some people may have a higher spend down, but most of their income is going out each month to pay their bills. So regardless of the amount of the spend down, cost is usually a big concern to the individuals we serve. So before I jump in here, I do just want to pause for a moment. We're going to spend the rest of our time together today kind of going through this process, the beginning to end, kind of outlining this at a very high level, answering some questions and talking about now how to set up the account and what that process looks like, how to use the funds, and we'll use an example to help us illustrate that. So the first step, and I do want to make sure I point out that the orders of these steps will vary. This is going to be dependent on a person's situation, whether or not they have resources to spend down, and where they are in this process already. So this is not necessarily always the order of how this happens, but it is typically, the order that someone would follow if they were starting right from the beginning of needing home care services. Looking at the resources that they have, they may need to spend those down. They may need to work with someone to do some planning solutions to get below those resource limits. That's going to be your first step. Some people might have no resources at all, so they can skip straight to step 2 and 3, where you're applying for Medicaid benefits. And in some situations, if the individual's not already receiving SSDI, that would be potentially a situation where the individual is older and they're not formally deemed disabled. But in order to use a pooled trust to spend down income and qualify for Medicaid home care, the individual does have to have a qualifying disability. And this is the Social Security Administration's definition. It means you're unable to work for a period in excess of 12 months. Many individuals who are in need of these services would qualify under that definition. It's just some additional paperwork that may need to be done and submitted with your Medicaid application, so they can do that review and formally deem someone disabled, so they're able to participate in this program. Medicaid applications can take up to 3 to 6 months. And I say that meaning from the time that you begin evaluating Medicaid, pulling together your documentation, submitting your application, and actually getting services in place. But the Medicaid application process can vary greatly depending on a person's situation. And so that's something that if you're curious about how long the process is going to take for a Medicaid application to be completed, you can certainly ask your local Department of Social Services when you submit the application, so you can get some expectations there. But as far as when you can get services in place, that'll be very dependent on the area that you live and the availability of services there. Applying for the pool trust, however, can take about a week. Once we receive the documentation, as long as everything's in order and we don't have any follow-up questions, we can establish the account in 48 hours. So that process is pretty quick. A lot of the times people ask, when should I apply for the pool trust? Should I do it before, should I do it with my Medicaid application? And the answer to that, again, is not necessarily black and white. It depends on your situation. It's up to you to determine what point it makes sense for you to establish the trust. Knowing that when you apply for Medicaid, it can take much longer for that to go through. However, we have been hearing from more counties lately that they are advising people to submit their pool trust application with their Medicaid application. That allows them to review everything together and can help make it more efficient for them and get services in place more quickly. So that would be something I would advise you to just ask when you apply for Medicaid, whether it's the individual who's helping you do that or your direct county, what they prefer as far as what's the best way and most efficient way for you to apply for these services. You certainly can, if you're already receiving Medicaid benefits and you have a spend down, skip right to step 4 and apply for the pooled trust. They may have to do that disability determination to make you eligible to use the pooled trust. And then you can start putting that spend down deposit into the trust on a monthly basis. Spend down deposits must be made each month. It has to come out of your income every month and be deposited into the trust within that month. That's what helps you maintain your eligibility for services. It's also important, once you establish a pooled trust, to inform Medicaid that you're participating in a trust. If we don't tell Medicaid that your spend down is going into a trust, they may not know, and then they may turn off services or be looking for you to pay your spend down. So it's really important that once the application for the pool trust is completed, that you submit that to your local representative, regional office, so that they're aware that your spend down deposit is going into a trust. They might ask you for things like a verification of your deposit, and those are things that you can typically request from the pooled trust. Just give us the information of where we need to send it. Then Medicaid will come out, they'll do an assessment, they'll determine how much care that you need, they'll allot a certain number of hours. You'll work with the agencies that are available in your area to coordinate that care. And the funds that you're putting into the trust each month are then able to be used for your living expenses and other, purchases of items and services that are for the primary benefit of the person who needs home care, the person who's benefiting from the trust and the funds going into the trust. So here's an example. Hilda is in need of Medicaid services. She lives independently in her own apartment, but she has diabetes. She's got some hypertension and mobility issues where she is in need of assistance at home. She's relatively independent, but she really could use some help with cooking and cleaning the house, things that she can't do anymore on her own. Her income on a monthly basis comes from Social Security, retirement, and a pension. And she is over the financial limits to qualify for Medicaid. But as you can see, she only has $5,000 in a savings account. So if she tried to private pay for home care services, that would, not last her very long at all, not even a whole month. So she's going to apply for Medicaid to get home care coverage, but her income is above those limits. So how does this look? It's important to point out that Medicaid determines this number. This is a very simplified version of the calculation that they do to determine what someone's spend down amount is. And this is just for an example purposes to keep it clean and straightforward. But when you apply for Medicaid, they will take into consideration a number of factors. There are deductions, and those are all very unique to an individual's situation. So with Hilda's income, we're going to take the total amount she receives from Social Security and retirement. We're going to subtract out how much Medicaid allows her to keep. So she can have $904 in a month and qualify for services. So it's only the amount that she is over that is required to be spent down. And that amount is $760. So once we take into consideration the cost of the pooled trust to administer the account, each month she'll have approximately $700 in the trust account to pay for bills, and she will keep $904 of her income in her own bank account to be used for her expenses as well. So when you look at this, as her options are give $760 to Medicaid and she can get services, but she's only left with $904 a month to pay her bills, which isn't going to be enough to cover her rent. And then obviously she's got lots of other bills to pay. So the pool trust allows her to deposit that money and protect it to be used for non-medical expenses and things that are going to allow her to continue to afford to live in her apartment. So she'll have approximately $700 a month that can be used to pay her living expenses. When it comes to determining what are the right items to use for the trust, we're always going to try and look at paying for living expenses, basic needs first, before we would pay for more life-enhancing purchases. So in Hilda's case, her income's pretty tight. She's got $700 in the trust, but she has bills like her rent, electric bill, cable. These are all things that she might use the trust for. And then she's going to have additional bills outside of that. So when we're looking at the best ways to use the funds in the trust, we usually try and identify a couple of larger bills that equal up to about what the spend down and what will be available each month, so that she knows on a regular basis what bills she's going to send to the trust and what bills she would pay for with the $904 she gets to keep each month. And then she's also got that $5,000 in savings that she can draw on when she needs it. So in her case, we'll look at first, what is something we might be able to pay automatically each month? Certain bills, fixed recurring expenses, can be paid automatically because it's a fixed amount that doesn't change every month. So you send us a copy of your lease, and we set that up for a certain day of the month to pay the rent on an ongoing basis without her having to send documentation every time she wants to use the funds to pay her rent. Other bills that change and fluctuate month to month, like an electric bill or a cable or cell phone bill, we do need a copy of that bill each month in order to verify how much needs to be paid. And so those are items that she would need to send in each month because that bill might fluctuate. So this is where, looking at how to make this most efficient as possible for people, it's good to try and limit the number of bills that you have to send to the trust, just to, make this process easier for you, and limit the amount of paperwork that you have to keep track of. Another, good kind of best practice is to identify a bill that's easy to get another copy of. If you go out and use the trust to buy groceries, you've got to provide us with a receipt for that. And that receipt could easily be lost, and it would be difficult to go get another copy of that receipt. But an electric bill is something that you can download or request another copy if you needed that. So those are some of the things to be thinking about when you're coming up with ways that you might use the money that's in the trust. Make it easy for yourself. Use it for things that can be done automatically. Pick bills that are a set amount if possible, or something that is easy to get a copy of that bill if you need to, if it's lost. Now, when it comes to using the funds in the trust, an individual can submit their deposits to the trust in a variety of ways. Each program might be a little bit different what services they offer, but most do allow electronic deposits from a person's bank account. In our program, we have the ability to do that as a one-time deposit when you open the account, and also on an ongoing basis if you're looking to use it to pay your monthly spend down each month. And that is one form that the individual fills out when they join the trust, where they can fill out the one-time deposit for that initial amount that they're looking to open the account with, which in our program is a minimum of $300. Or it could be the person's spend down deposit if their spend down is greater than 300. And then they can also use that same form to sign up for their monthly spend down. They would want to set that up to start in the following month and give us enough time to be able to set it up for the day that they choose. And then our organization will work directly with the bank when provided with their bank account routing information to set that up to be pulled into the account on a monthly basis. That saves them time of having to mail a check each month. It also makes it so that the individual doesn't forget to send their spend down. We know in certain circumstances, it might just be that they didn't remember that month. And it's very important that someone's meeting the spend down each month in order to keep those services in place. When someone's receiving home care, you need to be sure that your Medicaid benefits are active each month, because otherwise that home care aide won't be able to come in and provide services. When it comes to submitting requests to the trust, we do need you to authorize us to use the funds. So someone on the account, either the beneficiary themselves or a person that they've authorized to help them with the account, can submit requests to the trust using a form that they fill out, telling us what they'd like us to pay for, how much, signing that they're authorizing us to pay that expense, and attaching a copy of a bill that's either in their name or a receipt for a purchase or an invoice for a service that needs to be paid. Those requests can be submitted by fax, mail, and email at this time under our program. And those might vary with different programs as well, as far as the methods to get requests to the trust. We do process disbursement requests every day. When you send a request to us, we review it first in, first out, and we typically process payments in about 5 business days, as long as we're provided with all the documentation that we need and there's no follow-up to get additional documentation. That's a pretty quick process. We also are able to pay certain vendors electronically. If a vendor participates in ACH payments, some payments can be wired. So like a Verizon Wireless or Con Edison for electric bills, those funds can be wired directly to the vendor, which helps us pay bills even faster. And as I mentioned on the previous slide, there are automatic payment options. Things that are fixed recurring expenses can be paid automatically each month. Those have been traditionally rent, mortgage, and property expenses, things like maintenance fees that are a set amount each month. And we've recently added some new options like car loans and lease payments, irrevocable pre-need funeral and burial plans. And we would encourage people, if you have an expense that is a fixed recurring amount and you want to see about getting it set up on autopay, to reach out to us and we can work with you to determine if that would be possible. there are some rules about how the money in the trust can be used. And I've touched on a few of these throughout our discussion so far. But the primary rule is that the trust funds have to be used for the individual's primary benefit. If Medicaid is going to allow this person to qualify, despite the fact that their income is otherwise too high to be eligible for these services, they want to make sure that that money is being used for that person to help them pay their bills and help them be able to stay in the community as long as possible. That's the goal. Get them the care that they need and allow them to live where they want to live in their home among family and loved ones. Beyond that, requests are reviewed. Each request is going to be reviewed individually, and it's our responsibility as the trustee to make sure that we're looking at things with consideration of how something could impact a person's eligibility for government benefits. This doesn't come up too much for someone who's just receiving Medicaid home care. It's a little bit more relevant for someone who's receiving a benefit like SSI, where they're receiving money on a monthly basis for their food and housing benefits. Paying for items like food and housing for an individual who's receiving those benefits could impact their financial eligibility and cause there to be a reduction or a complete loss of a person's services. So those are things that the trust does when we're reviewing each request to consider how it could potentially impact a person's eligibility for government benefits. How we administer the trust is that requests come in from the beneficiary or an authorized contact. Once something is approved for payment, the trust will remit payment to a third party. We can never give funds directly back to the beneficiary or put money in their bank account. That would make that money available to them and could impact their eligibility for Medicaid services. So we're going to pay a third party. They submit a request to pay their cable bill. We pay Spectrum directly. They submit a request to pay their landlord for rent. We cut a check to the landlord. We don't give the money to them directly. That's what's going to protect their eligibility for benefits. We do need documentation to keep track of everything that we're using the money in the trust for. If Medicaid wants to see receipts, copies of bills, we need to be able to provide that documentation. So that's, another benefit of working with the trust is that each time you submit a request to us, we're holding on to that paperwork. We're digitally documenting that information so that that is available in case we need to report on it to Medicaid. Beyond that, it is important to point out that the funds can be used throughout the individual's lifetime. And as we discussed earlier with the payback provision to Medicaid, upon the passing of the beneficiary, the trust account must close, and we can't make any more payments out of the trust after the date of death. So that's really important to just be submitting requests to the trust as you have them. Don't hold on to a bill waiting to send it into the trust. You really want to make sure that each month, to the best of your ability, you're spending down the money that's available in that account as often as possible, so you're not leaving a large balance in the trust upon the passing of the individual. Now, here are some examples of some of the most common types of disbursement requests and what might be required for a person to submit these bills to the trust. So the most common is a bill that someone has, an expense like utility bill, rent, mortgage, maybe they have a loan payment, newspaper subscriptions. I mean, this could be things like Netflix subscriptions. You have a bill that's in your name, you fill out a form, you submit a copy of that bill, and we pay that company directly or that individual depending on what expense we're paying. There are also ways to use the trust to pay for, purchases that you need in the moment, right? So if you need to go to the pharmacy and buy diapers for someone that you're caring for, you need to be able to go out and make that direct purchase. So there's kind of two ways you can do that. The beneficiary can put that expense on a credit card, submit the statement with the itemized receipt with the request form, and we can pay the credit card company directly for that expense. Or they can have someone other than the beneficiary or their spouse go out and buy that and seek reimbursement from the trust. So I am a caregiver. I'm caring for my mom. I go out to the store, I buy the things that she needs, and I submit a copy of that receipt that either I paid cash, or if I use my debit card, I'll need to include the statement to show that I did purchase that expense, and they can, and the trust would reimburse me for purchasing that on behalf of the trust beneficiary. And that can be a way to give someone a little bit more flexibility and financial freedom in using the funds in situations where maybe they're sending bills to the trust, but they still have a number of, they still have money available that they want to use. Those are some strategies to help people do that. Again, we can't give cash to that person to go to the store and buy things, and we can't reimburse them if they go out and buy something with their checking account or their debit card. So it's got to be someone other than the beneficiary making that purchase and seeking reimbursement, or they can put it on a credit card. Those are options. Another, thought there is just send bills that you have that are in your name to the trust and save your $904 that you have in your income that you get to keep each month. That can be used for purchasing groceries and going out and buying over-the-counter items and things that you need throughout the month. Another common disbursement request is when someone's looking to make a purchase, a larger purchase, or perhaps have something like home repairs done, where they actually need to go get a quote or an invoice for a service or purchase, where they're actually going to submit that to the trust before they actually move forward to get that, approval from the trust and figure out what the payment arrangement would be to use the funds in the trust for that particular expense. So we've talked about a lot of these already, but these are some examples when someone is just receiving community-based Medicaid benefits. They're typically going to use the trust for their living expenses, things that are going to keep a roof over their head, make sure that they have their basic needs met, their bills are covered, they have food to keep them healthy, they have clothing and other personal items that they may need. It can cover uncovered medical expenses, things that aren't provided through other benefits that they receive. In some cases, when someone has a very high spend down, it can be used to help offset the cost of additional home care assistance. Perhaps they're not getting enough hours from Medicaid, or maybe when they were private paying for services, they were getting more hours. So looking for ways to kind of offset those costs, that is one option. Irrevocable pre-need funeral arrangements, always going to be a good idea if someone doesn't already have their burial plans together. If they haven't done that prior to joining the trust, that can always be a great way to spend down funds if someone has a higher balance in the trust or is looking for ways to spend down the money. Beyond that, once someone's basic needs are met, we're making sure that all their bills are paid and they're getting what they need. The funds can be used for additional, life enhancing type things. Maybe someone likes to get their hair done or their nails done. Those are things that, that make them comfortable, happy. Those are items that the trust would consider, but we're going to want to make sure that we pay those basic needs first. I do see some hands raised. I'm going to wrap up shortly and we're going to open up to questions. So just give me one moment and we'll jump in there. There are some things we cannot pay for. These are, cash to the beneficiary or putting money in their bank account, as we talked about. The trust is for the person's primary benefit. So we typically can't buy gifts for other people or things that are going to primarily benefit someone other than our beneficiary. Items covered by government benefits may cause a reduction or it could impact someone's eligibility for benefits. So those are things that we're going to look at on a case-by-case basis. When somebody owns a home, they certainly can own a home, qualify for Medicaid home care services. And while they're living in that home, they might be looking to make some improvements to that property. That is something that could be done when the individual owns the home and we're paying for expenses that are for a home that they live in and are the property owner. But if they're not the owner of that home, if they live with, let's say, a daughter or a son and their whole family, we're not going to be able to make capital improvements to that property. However, if there are modifications that need to be made to make that safe for the individual, those are things that would be considered on a case-by-case basis. Can't do leases between spouses, which is, a situation where we're essentially paying the spouse the income back. And that's like putting the money right into the household and would impact someone's eligibility for benefits. Can't pay for two different properties. People can't be renting and paying a mortgage somewhere. And it is a policy of NYSARC that we do not pay for alcohol, tobacco, firearms, illegal activity, bail, or restitution. This program is really a lifeline for individuals who need these services to be able to qualify financially for these benefits. And the purpose is to improve a person's quality of life. So these are items that under our organization, we would not permit these expenses. And beyond that, as we talked about, we can't pay anything after a person has passed away. So stay in contact with the trust. If someone's not doing well, reach out to the trust, talk to us about what they need, and we can come up with creative ways to help you spend down as much money as possible during their lifetime. There are some, other ways as far as tracking activity. One of the things that you really want to pay attention to when you're looking at a pooled trust and evaluating whether or not this is going to be a good fit for you is how easily is it going to be to get in touch with that trust? When are they available? How do I get in touch with the trust when I have a question? Are there ways for me to monitor the account when when the trust is not open? How do I track the activity? What are ways where I know how much I have available in the account and monitor that on a monthly basis? As I mentioned earlier, Medicaid might ask for activity history. They might look for specific receipts. They also might just be looking for us to verify that a person made their deposits throughout the year. So those are things that, what you'd want to ask the trust about. How do they facilitate that? Is that something that the trust would support you with? And what ways do they keep track of documentation? It's very important that we have this documentation. If it's a program that is not collecting that documentation, that's something that could put your benefits at risk. So that's really important. Again, when you're evaluating different programs, understanding what services are available to help you once you are in the trust and using this program to protect your eligibility for benefits. Now, from here, I have a number of kind of common questions, which we can go through, but I do want to these are more maybe for your reference after the fact. I know we have a lot of people entering questions into the chat, and we have lots of questions here. So I'd like to take some time to go through your questions first, but feel free to, refer to these other questions. These are just some kind of common questions that we get, common misconceptions sometimes about how a pooled trust works. And I'm going to skip to the end here to start with your questions first. So one question was, when a parent receives an increase in their Social Security, who do they contact to see if they need to put more money in their pooled trust account? So this would be a situation like this can happen if, let's say, you are married and your spouse passes away, and you might start collecting on their Social Security record, which could change the amount that you're getting. It might also be just annually, every year, Social Security benefits are slightly increased. There might also be, random points throughout the year where someone receives a new source of income that they didn't have before. So the answer to that is always going to be to contact Medicaid. You are responsible for informing Medicaid if your income changes. And Medicaid usually isn't going to necessarily catch it right away. So it's something that would, if you want to reach out to them proactively to have your spend down adjusted, or perhaps to have them review your new income to determine if your spend down would need to be adjusted. So that would be who you would contact first. And then the next step would be to contact the pool trust company. If your spend down is changing, you might be set up on electronic deposits. So that would be something you'd want to contact the trust to inform them of that change, and they can adjust your electronic deposit to pull more or less money depending on what your change in your Social Security was. If you're just sending a check manually to the trust each month, that's something where you just, once you get the notification from Medicaid, you would just start sending that new amount in the following month. So there's a question regarding the look back period for if a trust is completed November 1st of 2021, It will not be subject to the 2.5-year look back if the person applies prior to April 22. So I assume that you're talking about the type of trust to protect assets, and that would not be the pooled trust necessarily. But if you had assets that needed to be spent down, and the answer to this is still very much, not final. They haven't given us any sort of final regulations on this yet. But what they have told us is that those transfers of assets will be applicable to anything after October 1st of 2020. So technically that transfer on November 1st of 2021 is after that date. But they're not going to start doing a look back until April or perhaps later. So as long as you apply for community-based long-term care services prior to that implementation, it is our understanding that they do not intend to issue a penalty for that. It is something that it has to be long-term care services that you're applying for. If you just apply for basic Medicaid benefits without the home care piece, it will trigger a look back when you do if you do apply for home care at a later date. So that is important to, just clarify that it does need to be an application for home care services or community-based long-term care services prior to this new look back going into place. So you are correct in what you wrote there, as far as what we know at this time. There's a question of a list of definitions of disabilities. I'm not aware that there is a list in existence. The definition is pretty broad. But if you have a question about whether or not someone would qualify to use this program, that would be a good thing to ask Medicaid. You can certainly talk to them about it. And usually it just comes down to a need for these home care services. If somebody has a need for home care services, there's typically something that would qualify them to use a pooled trust to spend down funds in order to qualify for those benefits. There was a question, and this is with regard to funds being in the trust upon someone's passing. So when a person passes away, the trust account closes, and we can't pay anything out of the trust before we either repay Medicaid for the services that were provided to that person. So this is correct. The question was the family would not get the funds, and that is true. But this money is not necessarily your assets that retirement accounts, stocks, bonds, things like that. We're talking about your monthly income that you're putting into the trust each month and using to pay your bills. So there shouldn't be a large amount of money in the trust when you pass away. And if there is, you're receiving the value of the Medicaid benefits on a monthly basis, kind of for that, amount that may be left when you pass away. So you're getting a much bigger value than any amount that may be left in the account at that point. That money would not be able to go to family members, but if you did other planning ahead of time, those are the assets that you would be able to potentially make sure you could leave to family, like your home, things like that. Someone asked if funeral expenses could be covered from the trust. And the answer is yes, funeral expenses can be covered during a person's lifetime, and we need to pay for them using an irrevocable pre-need plan. That's when someone goes to a funeral home, sets up, basically enters into a contract with the funeral home, detailing out what services they're going to receive as part of that. And the beneficiary will either pay that in a one lump sum payment, or they will pay it in installments. Like I said, as an automatic payment is another option. Sometimes when people are looking to spend down funds before they even get Medicaid benefits in place, they might do that by purchasing an irrevocable pre-need. So that can be either done before they enter the trust, or if they have funds available, it is a common expense people use the trust for. Someone asked about, they understand that the trust is irrevocable, but they asked if you can cancel the trust and divert the income back to the beneficiary, if that, and what happens to the balance at that time. So this is actually one of the slides that I have here to kind of explain how that works. And I'll pull that up for you guys. So the trust is irrevocable in the sense that it's something that you set up and it can't just be undone and we can just return the money to the person. If that was possible, it wouldn't actually protect a person's eligibility for benefits. Medicaid would consider that money available to them because they can get direct access to it anytime. So the way this works is if somebody, let's say they no longer need Medicaid benefits, or they just no longer want to participate in the pooled trust, that individual can choose to no longer participate by calling the pooled trust, informing us that they no longer need the trust or that they no longer want to use the trust. They'll stop making any deposits to the trust. If they still have Medicaid benefits and they still need to pay their spend down, they'll have to do that some other way. But they can just stop making any future deposits, and the money that's in the account is still their money and it's available to them to be spent down on eligible expenses. So even though they may no longer be putting money into the account, the funds are still there for them to use during their lifetime. Upon their passing, anything in the trust would stay with the trust. But as long as they're still alive, they would be able to submit requests to the trust and use the funds until that account is fully expended. So someone asked about IRA distributions. So and what happens to those? If it's not necessarily monthly income, but if the trust could receive the annual required minimum distribution from that account as a lump sum payment. And the answer to that is yes. That is something that the retirement account, the principal balance of that is typically not going to count against you when you apply for Medicaid, but you may be required to take a minimum amount out of that retirement account on an annual basis. And that is considered income to the individual. And so that money could be deposited into the trust as a lump sum to spend down those funds for Medicaid eligibility purposes. Someone asked about kind of the process for making requests and how that works, if they're able to administer the trust for their father. So yes, the process for sending in requests is, we, NYSARC, the pooled trust that is administering the account and helping the beneficiary use the trust to pay for bills, we are in control of actually making those payments, but we're looking to you, the family and the individual, to tell us what you need that money for. So those requests can be submitted by the beneficiary and anyone who that person authorizes to submit requests on their behalf. So if you're helping your parent with this account, you can be authorized to submit requests for them. You can be in charge of kind of sending those bills to the trust. And then the trust would make the payment to the third party. And those are people who can be authorized on the account at the beginning. They can also be added or removed as needed. As we know, those things can change, throughout a person's participation in the trust. And I want to just take a moment to thank my team, Nina and Josh, who have been jumping in and responding to some of your questions in real time. I do hope that we were able to get to most of the questions. I do see there's a couple more in here, but they do seem to be repeated, kind of different versions of some other questions we've already covered. So with that, I'm going to wrap things at this time. I do, again, want to just encourage everyone, if you have additional questions, don't feel like you need to answer these questions yourselves, or, if you're thinking about this for a family member, just know that we're here to help you, guide you through this process, provide you with what information that we know. Certainly, we've talked about a lot of topics today. I want to make sure that everyone, just kind of reiterate, everything is very unique to an individual's situation. This is not legal advice. I'm not an attorney, but we do know a lot about how this process works, and we're happy to be a resource to you as you have questions as it pertains to the pooled trust and how this program can help you, a loved one, or the individuals that you serve qualify financially for Medicaid home care services and other means tested benefits as well. I would say, I would encourage you, if you've been working with us for a while, there's probably something we can help you with that you're not, working with us for. So always feel free to, reach out to us, contact our customer service team, contact me directly if you'd like us to come out and do a training like this for your staff or for people within your community. We're always welcome to do that. I thank you all for your time. We had, a really great participation. Love to see all these questions. I miss seeing you all in person, but I really love the opportunity to still be able to connect. And we appreciate you guys taking the time to spend your afternoon with us. We encourage you to reach out to us in the future, and we look forward to the opportunity to work with you. So thank you, everybody. Hope you are all staying safe and well, and have a nice day. Enjoy this beautiful fall weather.